Dr. Alka Sen, obstetrician and gynecologist in Agra, and I'm practicing since last 1988. Before I'll go to my topic, I want to clarify one word, that is the health. Health is a big misnomer in the general public. Health means you have to be obese. More you are fat, more you are obese, you are healthy. If you are lean and thin, then you are weak. But it is not like that. A fat person can be weak and a lean and thin person can be healthy. So, first of all, we should know what is the health. Health is a very composite word and it consists of your mental, social, emotional, psychological, and even the overall health of the body. My topic today is the healthy weight gain during pregnancy. And again, there are lot many myths the weight gain during pregnancy. First of all, we should know why this weight gain is there in the pregnancy. In the pregnancy, the body of a lady has to prepare for a lot many things to harbor a baby inside, a live person inside the womb of the lady. And for that preparation, there are the increase in the breast size. The fat should be deposited on the thighs and the hips. That all will be needing while there is enlargement of the baby, enlargement of the fetus inside the body, and the breast size increased because lady has to lactate after the delivery, and the uterus size is increasing from such a short size of the uterus. It goes up to the G sternum, yani ke umbilicus, it is above umbilicus. So the size of the uterus increases, the weight of the certainly the weight of the uterus will be increased. The in the sac where the baby is lying, it has got some fluid inside that is called liquor amniae. The weight of the liquor amniae, the weight of the placenta, the weight of the baby, and last but not the least is the increased volume in the body of the lady, of the pregnant lady, that will be needed for the good blood circulation inside the lady, and because she has to nurture a baby inside the womb, so for that she requires to increase the increased volume and the blood. So these are some factors that contributes the weight gain during pregnancy, and it is must. Now we should see how much weight gain should be there during pregnancy. This weight gain depends upon the pre-pregnant weight of the pregnant lady and the BMR. BMR is the basic metabolic rate. The basic metabolic rate means it is the energy consumption of a body at the rest. That is called BMR. And this BMR is being calculated by the age, weight, and the height of a person, of anyone. It's not only the pregnant lady, but it's for anyone. So BMR is a very important factor that gives us the guide how much weight gain should be there during pregnancy. So anyone can calculate the BMR, and according to the BMR, the weight gain should be like in that way. If anybody's BMR is less than 18 or 19, the weight gain during pregnancy should be 13 to 18 kg. And BMR, if it is in between 18.5 to 25, the weight gain should be 11 to 16 kg. And if it is more than 25, then the weight gain should be 7 to 11 kg. And if it is more than 30, I mean it is an obese person, for the obese person the recommendation is only 5 to 9 kg weight. So these are the parameter that indicates that should be very much known to every pregnant lady, and it should be in the we should track, every pregnant lady should track the weight gain. Now we'll see that weight gain, it is depending on the trimesters also, the first trimester, the second trimester, and the third trimester. During the first trimester, the weight gain is very minimal because there is perversion of taste, there is loss of appetite, the patient feels drowsy and weak because the much of the energy of the lady needs to grow the baby inside, the fetus inside, because this is the period where all the organogenesis and the complete formation of the baby is there till 12 weeks. And there are some changes in the hormone of a pregnant lady, so those hormones give the perversion, so lady don't like to feel eat a normal food, and she may like empty calories food, any of the food she can take, but she cannot take the nutritious at this moment. So normally, if the lady is not feeling any perversion or any loss of appetite, then the weight gain is normal. But in 90%, 85 to 90% pregnant females, they feel in the first trimester the perversion of the taste and the loss of appetite. So because of that, there is a very minimal weight gain during first trimester, and sometimes it happens because of the excessive vomiting, there is a fall in the weight. So I want to make this point very much clear, because when there is a fall in the weight, or there is a decrease in the weight in the first trimester, the lady and its relative, they get panic, so they feel like there is something wrong, why she is getting reduction in the weight. But it is not so, because these reduction in the weight that affects only the lady but not the fetus, because the fetus is getting the whole of the energy that is conserved in the pregnant ladies, the reserve of the pregnant lady that is being consumed by the growing fetus inside. And this perversion and loss of appetite and decrease in weight does not affect in the development of the fetus inside. And it has been seen that as soon as the lady finishes the first trimester, that is 3 months, that is the 12 to 13 weeks, the all the pregnancy hormones, they are getting settled down, and this perversion is getting a little bit, gradually it becomes normal, and the eating habits are become normal, the loss of appetite is gone, the lady comes into the normal appetite, and the vomiting subsides, and the weight gain starts. So now we'll see this weight gain, what should be the rate of the weight gain. Ideally, it has been seen that it is 1.5 to 2 kg weight gain per month, or more or less you can say it is zero point 0.5 kg weight gain per week. In an obese patient, it should not be more than 0.2 kg per week. But these are the ideal situation. All the time it is not the ideal. At times we used to see that there are sudden increase like 2 to 3 kg weight, 3 or 4 kg weight in this week, in this month, and there is a very small, a very minimal change that depends on your eating habits. So normally it has been seen that 1 kg weight per month is supposed to be an average increase weight, because if we'll see the average Indian females, the height is 5.5 nearly, and the weight is around 50 kg, and the BMI falls in between 18 to 25. So the average weight gain should be not more than 10 to 12 weeks. And in 9 months, 10 to 12 week means 1 to 1.5 kg weight gain on an average per week. So this is the rate of the weight gain during pregnancy. Now we see this. I have already told you this weight gain is because of what? Because of the breast, because of the uterus, because of the placenta fluid, and the fat in the body, on the hips and the thighs, because this is the preparation. So after delivery, the 50% of the weight gain is reduced, because the uterus getting down, the weight of the uterus is almost getting to the normal after delivery, not immediately, but suddenly, just after delivery, it has become on 20 kg, 20 week size uterus, and the placenta is removed, the baby is removed, the fluid like amnion is removed. So all of these things, they used to give the at least 50% reduction of the weight. Now, I'm just completing my talk in a very short way. The main main attractive features I'm just giving you. Otherwise, it has a very long talk. So there are some myths during pregnancy of this weight gain. Number one, it should be the weight should increase from the first day of the pregnancy. If the lady is pregnant and she used to come on the first visit, so she used to say that there is no weight gain, the lady is looking so weak. It's not like this. I have already told you, in the first trimester there is lot many energy consumed by the lady, so there may be increase or there may be even a reduction of the weight. It should not be a matter of worry. The second is that depends on your diet, what you are taking. If the weight of the baby, if the weight of the lady is not increasing, it doesn't mean that your baby is not growing properly, because your obstetrician is looking all the time clinically also, and the ultrasound is being done. So by all these parameters, it may be possible that the lady is not increasing weight because of its reserved fat inside. But if the baby is developing proper, there should not be any worry, because this the only motto in the during the pregnancy is the health of the baby and the health of the mother. So if the lady is not feeling any weakness and the baby is developing, is growing properly, and the weight is not increasing, it's not a matter of worry. It is only a matter of worry if there is improper development of the baby. It has been seen that there is a comparison of a pregnant lady to the another pregnant lady. She has gained 20 kg weight. I have not gained so much of amount. I am only gaining 9 kg weight. It should not be like this, because everybody's body structure, composition, and the metabolic rate and the metabolism is absolutely different. Two ladies cannot be similar in that way, that she has increased 6 kg weight, so you also should gain 6 kg weight. That depends. Fourthly, there is a myth, a very, very old myth is there. After completion of the 7 months, all the females in the house, the elder ladies, they used to give lot many calories to the pregnant lady in the form of laddus, in the form of ghee, in the milk, in the form of all sort of dry fruits. And it should be like this all the time. She used to say that she should eat all the time, and there is a tremendous weight gain after 7 months because of the too much of calorie diet. They are intake is too much, but they are not doing any physical exercise, and this imbalance causes at times hypertension, may cause diabetes, may cause difficulty in sitting, difficulty in lying down, because there is a sudden increase of the weight, and this is not the healthy weight gain. This is absolutely an unhealthy weight gain. So it is again a myth. We should not give any this kind of high calorie diet to the babe, to the pregnant lady. We should give high protein diet, good hydration, good minerals, salads, milk, paneer. This is the right diet to give even after the 7 months. It is not this May that we'll give the greasy food and the baby will come out and the baby will slip down in the birth canal. This is absolutely a myth. And last but not least, the myth is that the pregnant lady should eat for two. Not like this. The lady has to, no doubt, she is bearing a living uh, inside, living creature inside, and she needs really something very much good food, and good amount of the food should be taken to for the development of the baby inside. But it is not like this. If the lady is having the, if the lady is having diet of two rotis, so she should take four rotis, not like this. I had a question from the audience. Hina is asking, why is my weight important to my pregnancy? I have already told Hinaji that the weight gain during pregnancy is mandatory because of the lot many metabolic reactions and lot many calories, lot many energies which we really need to give to the developing baby inside. The increase in the breast, increase in the fat and the thighs on and the hips, and there is increase in the weight of the uterus, there is increased volume of the blood and the fluid inside the pregnant lady. So that all contributes in the weight gain. It is important. But if it is not that important, if you are able to feel good and the baby is developing okay and your weight gain is 1 to 2 or 5 kg weight gain, then it is not a problem. Poonam ji is asking, how much extra should I eat in pregnancy? That's why I was describing it. We should not take any extra diet for the pregnancy, but we should balance our diet in that way, so that the lady should not feel drowsy, that the lady should not feel weak. And it is a thumb rule during pregnancy to take the small frequent meals. The small frequent meals means that we are taking small meals at one time, and after 2 hours we are taking another small meal. That actually gives a constant increase in the glucose of a pregnant lady. So the lady will not feel burden on the intestine for the digestion, and the lady will not feel like low glucose if we'll take two meals at a quite a distance apart. Like after 4 hours, in 2 to 3 hours, if you have taken meals, after 2 to 3 hours, you feel down because your glucose level goes down. So the small frequent meal is absolutely a very good habit to take during pregnancy. Padmaji is asking, is it safe to diet during pregnancy? Very good question. Diet, what do you mean by diet? Diet doesn't mean that we should cut short our diet. Diet means that you are taking that diet that is balanced for your body. Like if your body needs, during pregnancy, our body needs good protein diet. We should take good protein diet. We should not take high fat or carbohydrate diet. We should not cut off the carbohydrate and fat, but we should take the carbohydrate and fat in a smaller quantity, because the baby is growing, the muscles are growing. So we need a balanced diet, bones, muscles, brain, and whatever we need to develop a body is the balanced one. We need the calcium, we need iron, we need protein, we need all the things. So we should diet in that way. If you are obese, if you are having a already pre-pregnant level is too much, we should avoid taking the fat and the carbohydrate, but we should not cut the carbohydrate and fat, because it is necessary for the good digestion. So we should not diet in that way, that we should not cut off over any lunch, dinner and anything, but we can reduce, we can take in a measured quantity of the ingredient or the nutrients of our diet. Sonalji is asking, gain weight safely during your pregnancy. Gain weight safely during your pregnancy, I'm talking about that. So how can you gain weight safely during pregnancy? There are some parameters which I have given on the basis of your pre-pregnant level of weight and the BMR. So there is more or less, by and large, we can say that in 9 months we should have a target to increase the weight for 10 to 12 kg. Usha ji is asking, is this safe to lose weight when pregnant? I don't think it is not, it should not be deliberate. The weight should not be deliberate to lose. If it is losing because of some other problem, because there may be some comorbidity along with the pregnancy, so if it is losing, it must be closely vigilant. You should be in a close watch to your doctor why the weight is losing. And this loosening of the weight, this reduction of the weight of a pregnant lady, whether it is giving some side effect or some wrong effects on the development of the fetus, then it should be a matter of concern. So losing weight during pregnancy is not very safe. But if it is there, there is some problem, there is some comorbidity, and it should be looked after properly. So during the pregnancy, I have told lot many things. What should we do? We should see. We should have a track on our weight increase in our during the pregnancy, the whole journey of the pregnancy. The concluding words I would like to share with all of you, that we should avoid excessive weight gain. It is very important, because once you have gained weight, it is very difficult to lose weight after delivery, and it becomes a point of depression in all the ladies, because their whole of the figure is lost, and then they are jealous of it, that why I am not in that way smart as I was before. So for that, we should do something in during the journey of the pregnancy. That is, we should have a track on the weight gain. We can have the track on the weight gain. As I have told you, the rate of the weight gain should be there. More or less, by and large, you should have a target not to go beyond 10 grams in 9 months. You should avoid taking the very big meals at a long interval. You should have small meals at short intervals. Be active and behave like this, that you should do all the exercise. You, because pregnancy is not a disease, it is a condition. So you should do all the activities. You should not do that activity which is difficult for your uh, physical capacity. It should not be done beyond your capacity. You should drink water regularly throughout the day. It's not like this, you have taken 1 liter of water in the morning and 1 liter in the evening and 1 liter in the night. No, it should be in a small, I mean, keep on drinking water whole of the day, to keep you hydrated and to keep all the things, all the cells hydrated, so that they will behave normally and the blood circulation is maintained normally. There are pregnancy craving, so pregnancy craving should be made constructive in that way, that all of your craving, if you are feeling having the sweet, so sweet should be in that way that it should not increase so much of weight. It should be in that way that you can take sweets in a definite quantity, in a balanced quantity. And I have told that the pregnancy is not the thing to be taken to be eaten for two. It is to be taken, eaten for one, and there is some more nutrients that is helpful in the development of the baby. Avoid taking white bread, pasta, and the white rice like these, because these all are the empty calories. They are not having the good protein inside. They are having that protein that increase the weight, but that will not give you the proper nutrients. So what should you eat? You should eat brown bread, you should eat brown rice, and the good nutrient fruits. You should avoid junks. Junks means all the things made up of maida, because all these maida stuff, these are very difficult for the digestion. And if once your digestion is weak, then you will start feeling weak, because all of the things, that nutrition you are taking is not being absorbed by the intestine, because the intestine is coated by the maida. You should avoid empty calories. You should take proper rest and the sleep, because rest and the sleep, again, it is very important for the healthy pregnancy journey. So I can conclude now. During pregnancy, the pregnancy is not a disease. Pregnancy is the that period of in the pregnant in the lady, that period that gives you lot of anxiety, lot of amusement, and it is a period to celebrate, not to feel that you are ill, not to feel that you should eat this and that, you can't eat this and that. You can eat each and everything, but if you are choosy to take, if you are intelligent to take, and if you are absolutely knowing the parameters, what is to be taken and what should not be taken, so you can have this journey very fruitful, very amusing, very entertaining, and this journey will give you a very good product in the form of your fetus. Because if we are taking the nutritious diet, a good hydration, good physical exercise, proper rest, proper sleep, and proper fluids, so even you are happy, and the baby who are coming to you in your lap will be happy. And I have seen in lot many cases, if you have taken lot of junk food, lot of sweets, lot of laddus, lot of oily stuff, your weight is so much that you feel difficulty, and your all happiness will go when you deliver. You have got the same weight as you having, because after the delivery, the old ladies, they are interested to give lot many oily food even after the delivery. So whatever 50% you have loosened after the delivery is being gained by that diet which are being given after the delivery. So whosoever is listening my program, it is my concluding words, and the take home message is that to maintain your health, that to maintain your body weight is in your hand. And uh, what is going to do, the whatever you are taking for you and for your baby, it should be a balanced diet, regular exercise, regular checkups, and the good sleep and the proper rest. Thank you.